Welcome to Providing Care in an Emergency, a review of first aid and wound care for caregivers, provided by American Way University. My name is Angie Danielski, and I have developed this course as part of continuing education hours required for caregivers in the assisted living setting. In Part 3 of the presentation, we will discuss soft tissue injuries, including wounds, burns, and sprains and strains. We will also discuss focusing on prevention of injury with elderly residents. When discussing wounds, it is helpful to understand the different layers of the skin. The outermost layer is called the epidermis. The epidermis is largely composed of dead skin and contains the oldest skin cells. The middle layer of the skin is called the dermis. The dermis contains blood vessel endings, as well as nerve endings and sweat glands. The innermost layer of the skin is the subcutaneous layer, or the fatty tissue layer, which helps to provide a cushion and warmth for the body. Soft tissue injuries to the skin are usually referred to as wounds. Wounds can either be classified as open or closed. Closed wounds are bruises. A bruise is simply a collection of blood underneath the skin where blood vessels have broken and blood leaks out under the skin. Open wounds are usually classified depending on which layer of the skin is involved. An abrasion is a break in only the superficial layer of the skin, or the epidermis. With an abrasion, no bleeding occurs. A laceration is a break in the skin that at least involves the dermis of the skin. However, it can also be deeper and involve the subcutaneous layer or go down to the bone or muscles. A puncture is an open wound that covers less surface area of the skin and can involve any layer of the skin, from the epidermis from a staple, to the dermis from stepping on a nail, to the subcutaneous layer and beyond from a stab wound or gunshot wound. We'll discuss more how to care for open wounds later in the next few slides. When caring for an open wound, it is important to keep the wound clean as well as take steps to minimize bleeding. Caregivers should always put on gloves before caring for a wound. The first step is to cover the wound with a sterile dressing or gauze square. Direct pressure should be applied over the wound to help limit bleeding. If the wound bleeds through the dressing, simply add more gauze. Never remove the first dressing that was placed, as a clot may have started to form and can be ripped away by removing the dressing. If a wound continues to bleed, elevate the wound above the level of the heart. Elevating the wound can help to reduce the blood flow as the heart has to work against gravity, so bleeding is thereby reduced. If the bleeding still persists, pressure can be applied to a pressure point to help reduce the bleeding by limiting the blood flow to that area. Burns can occur due to thermal, electrical, mechanical, or radiation causes. Burns are classified according to the layer of skin affected. Superficial burns, formerly known as first-degree burns, only affect the outermost layer of the skin, or the epidermis. This type of burn is like a sunburn, where the skin becomes bright red and hot to the touch. This type of burn can be run under cool water to help provide relief. Partial thickness burns, formerly known as second-degree burns, are those that affect both the epidermis and the dermis. In addition to the hot red skin, partial thickness burns will also have large fluid-filled blisters. Caregivers should avoid breaking these blisters. However, in the event that they are broken, they should be kept covered and clean. A full thickness, formerly known as third-degree burn, involves all layers of the skin and may be down to the muscle or bone. Those with full thickness burns most likely will not feel pain because the nerve endings are damaged. Excessive amounts of heat will be lost through full-thickness burns. This type of burn needs to be covered, and the resident should be taken to the hospital immediately. When tendons and ligaments are overstretched, they are referred to as a sprain or strain. In this instance, the injured area will likely have swelling. In order to minimize swelling, we should think RICE, or R-I-C-E. The R stands for rest. The injured area should be rested and moved as little as possible. The I stands for ice. Ice is applied to the injury to help reduce swelling. Ice should only be applied for 15 to 20 minutes and then removed for the same amount of time. This process can be repeated. The C stands for compression. Applying a pressure wrap around the injury can help to minimize swelling. Caregivers should ensure that the resident still has feeling in the extremity lower than where the compression wrap is applied. The E stands for elevation. By elevating the injury above the level of the heart, the fluid in the area can help drain back towards the heart. In order to keep residents safe, caregivers should focus on prevention of injury. This can be accomplished by maintaining areas free of clutter, especially walkways and doorways. For those residents who have assistive devices, such as canes and walkers, caregivers should ensure that residents use these devices when standing and walking. If residents have glasses or hearing aids, caregivers should ensure that the residents use these devices. If a resident is at a fall risk, their bed should be left in the lowest position, so in the event that they get up in the middle of the night without waiting for a caregiver, they will not fall a considerable distance. Lastly, caregivers should try to anticipate the needs of residents and provide any assistance to those residents whenever possible. This concludes the final portion of the American Way University training of Providing Care in an Emergency. Thank you for your participation. For further training opportunities, please feel free to visit our website or call our office.